An amendment from the Mississippi Division of Medicaid proposed a week ago called for significant reductions in the amount of money that goes to services families need for children that rely on special care, specifically from private duty nurses. The division's proposal on September 5th would largely affect private duty nurses who handle treatment for providers and for the families who rely on their expertise. Hope Healthcare is one of those businesses that provides care across the state with nurses who work for them.
The goal of Hope Healthcare is to keep these chronically ill babies at home and well, out of the hospital. And a simple cold for these kids is a 2-week stay in the hospital.
We're able to take care of these children in their home. We provide their health care instead of being in the hospital. We're just able to provide a better life for them in their home and for their parents to have peace of mind.
In the proposal, the agency looked to slash the budget by 40%. They projected an annual aggregate savings of nearly $8 million. It would be a move that would put Brazil's business in jeopardy.
We absolutely would not be able to stay afloat with these cuts. There's no way, not with the overhead that we're required to have.
That overhead includes taxes, health insurance for many of her 300 employees that are eligible, along with required malpractice, liability insurance, and workman's compensation. But that's just the business impact. Not being able to care for those in need would be even greater and would have a domino effect on families too.
Wouldn't be able to work. I rely on my nurses so that I can go to work. I would have to stay at home to care for him because we can't just take him to a normal daycare or just leave him at school by himself. Many children would stay in the hospital if they did not have the care from their nurses.
The proposed cuts created a firestorm of reaction from parents who need these services, and apparently the state's Medicaid division heard the response. As a matter of fact, as of today, the agency posted on their website that they will not be submitting this proposed state plan amendment to the Centers for Medicare and Medicaid Services at this time. Troy Johnson, 16 WAPT News at 10.